I'm a plastic surgeon at Dayton Children's Hospital, and I had been working on a couple of missions to Guatemala, and while we were there doing cleft surgeries, one of the directors of the Shriners asked if we could be potentially interested in seeing some more complex cases. He pulled out his phone and said, "How about this?" So at that point, I brought the case back to Dayton to my colleague, Dr. Rob Lober. There are a few people in the world who truly are geniuses. He's one of them.
Conjoined twins is a rare condition. Pedro and Augusto, they're connected at the tops of their heads, and they're slightly rotated.
It's that rotation that makes this so challenging.
It's understandable that spending most of their time lying on their back in a hospital bed, despite amazing nursing care and extra attention, they're developmentally delayed, so they're 3 years old. You know, they're really intellectually more like 18-month-olds. I mean, they can get up and walk a bit, but it is incredibly taxing on them.
Positional pain, neck pain, back pain, just a lot of functional disability in terms of being, able to be mobile.
Ay, qué alegre.
There's an imbalance in their blood flow, and these kids are already showing some signs of organ problems. Most common story is that these twins live into their 30s or 40s. This particular setup, I think, is really going to consign them to lying around most of the day in a hospital bed, and it really is just not a good quality of life.
I think the family, they've been praying from the first day that this was a possibility that they could be separated.
Mi nombre es Luisa y soy de Guatemala. Me vine por mis hijos, para ellos que tenga un futuro mejor y que ellos, yo sé que ellos también sufrieron bastante.
This has been like 2.5 years in the making. This started off with Dr. Lober and Dr. Gordon showing me a picture of the twins, and they captured my heart. It was a whirlwind to get them here. I was actually able to fly down with Dr. Gordon to go get them.
To do this ethically, we had to come up with a plan that would let both kids have a reasonably good chance of coming out of this with mild deficits and have a good life.
So after a lot of discussions and a lot of study, we decided that the safest way to do this, if it was going to be done, would be multiple surgeries over several months. We think we're really well positioned and ready to do a procedure like this. We saw the possibility that we could offer them hope at having a normal life.
Augusto and Pedro have strong personalities. Augusto is definitely the more chill, relaxed one. If you take away a toy but give him something else, he's okay. He just kind of is go with the flow. Pedro's the opinionated one. He wants what he wants, and he will tell you if he doesn't. They both love dancing and music. As soon as you turn on the music, everything's fine. They don't care what else you're doing, just let them dance. So we found during their clinic visits, keeping the music going really helps them. So the goal of medical play is to decrease anxiety. So instead of the mask coming at them while they're being pinned down by medical staff and they're scared, it's a lot of just introducing the item and engaging in play. They've had multiple imaging procedures, CTs, MRIs. They've been sedated for all those, so I've been there throughout that whole process. And they're going for surgery soon, which will have a long inpatient stay.
They share venous circulation. One child's blood vessels drain into the others, where they both are semi-dependent upon one another. And the question becomes is whether or not they can be made to rely on their own independent drainage. All the tests that we have done up to this point have been toward answering that question. And we're now at the point where we feel it's safe to proceed to see if this is a potential for safe separation.
Good morning, boys. Good morning.
All right, the dancing has begun.
Before making any vascular disconnection, we're going to test clamp a vessel and use angiography to determine if the blood reroutes the way that we predict.
The plan is the same.
Tenemos el mismo plan.
We'll give you constant updates, okay? And this will determine whether the separation is even possible.
You want to actually pull these out and grab a warm blanket for me?
Today we're doing angiography, and then we're going to do a craniotomy for test occlusion and possible ligation of the anterior vessels that connect Augusto to Pedro. Honestly, nobody's ever done this surgery before, so if you see something that looks like a safety concern, seriously speak up. Is everybody in agreement with proceeding? Agreed. All right, let's do it.
We've been practicing, rehearsing, planning for a couple of years now, and I think we have all the pieces in place. And now our interventional radiologists are going to be placing catheters up next to the brain and injecting dye so that we can confirm in our access points to make sure that it's safe to clip where we want to clip.
Dr. Akil Patel from Kettering Health is a huge partner for us, and for Dr. Lober, quite frankly.
There's one guy that you want in this surgery, it's Dr. Patel. He is an extremely important part of this team because of his expertise with blood vessels in the brain. He's been incredibly valuable being able to provide advice and expertise, and also the blood vessel imaging during the operation.
See, these are all the internal branches. Keeps going, and then there's your vein. The gold standard study that really helps most to understand the blood supply in the brain is via cerebral angiography or formal cerebral angiogram. We're taking pictures with contrast to get a really good sense of blood supply.
When you squirt the dye into the artery of one child, you see it pass through their arterial system, capillary beds, and then into the venous system and out. The angiography really takes you through in real time the path the blood is taking. Veins can close and open, so as soon as you clamp a vessel, you see the picture changes and they find a way to get the blood flow.
Keep going.
Yeah.
Look at that.
Yeah.
Beautiful, baby.
Yeah, that's it. Yeah. Gogi, are we good? In addition to the question of whether or not we can occlude that vessel safely, there's the question of how do we disconnect it?
We were dealing with blood vessels that were larger than I've ever seen in a human brain. The shared blood vessels at the back of these two kids' heads were this big around. And if we had just tied suture ligations, it would have ripped through. So we started thinking of other ways to control the bleeding. How else can we do this? One of our pediatric surgeons says, well, that's like perfect for the just right stapler.
Let's take a look at this.
So this thing is meant for GI, and then like that, close. So that's what you get.
Wow, look at that.
And I'm kind of thinking it might work.
Wonderful.
The just right stapler is for bowel surgery, not neurosurgery.
It really was designed to clamp onto tissue, shoot double rows of staples to close the tubes, and then this little razor blade goes between the two clamp sides. Voila, you've got two separated vessels which are closed with a row of staples. And that actually is more reliable probably than any of the hand-sewn methods. The first time we used it though, I mean, it definitely gives you a moment of pause.
3 is down.
Yeah, 4 is to fire.
Okay, firing. Oh. Nice.
Oh, that's nice, dude.
Good?
Yeah.
Feel a little woozy. All right.
I need to lay down. These first disconnections were a huge step forward, showing that separation might actually be possible. Maybe we can do this.
How are the boys acting?
Esos también casi que, o sea que ayer pasaron peleando todo el día.
They're fine. Well, yesterday they spent the whole day fighting.
Does she think they're in pain?
¿Usted cree que a ellos les duele algo?
Yo creo que no porque tal vez están desesperados porque están pegados y
Maybe they are just
se cansaron al
desperate because they are
costado.
connected together and they get tired.
No sé por qué, porque solo Dios sabrá por qué.
Honestly, I don't know.
Así
I couldn't
están mis
tell you.
hijos,
Only
porque
God knows. My children, they are like that.
Es más difícil para mí porque a ver
More
así
difficult for me.
es triste
It's sad.
y así pegados y hasta me da ganas de llorar de verlos así.
They are connected and I feel like crying when I see them like that.
Y me cuesta un poco, pero ahí estamos.
It's difficult for me,
Y
but
al final que luchar por ellos.
we are
hacer
fighting for
adelante.
them.
The first surgery had some difficulties. We were very happy that we were able to carry out the steps that we had planned to do. It actually went very, very well until it didn't. After what appeared to be correct surgery, suddenly 30 minutes later, we were having life-threatening hemorrhage.
They bled about a third of their blood volume in a minute and a half. And then we basically just held pressure and we got blood back on board and everything sort of simmered down. We just sat there for a while.
We had done a lot of mock drills, and it was word for word. It was starting to get a little uncanny that we were going down that road. I felt like we would be doing chest compressions very soon.
Hi.
Buenas
So we were able to accomplish what we went to go do. Before we were able to close, suddenly there was bleeding. We were able to get it under control. It still was very stressful for them. We think it's going to be okay. It's safer to keep them asleep for 2-3 days.
Se está trabajando a través de sus manos, de su inteligencia que ustedes tienen.
God's working through your hands.
We pray for the boys, but we also need prayers too. So.
They've seen everything move except the left side, so I just say we keep them asleep for 3 days. Sure. I'd love to know right now, but it's not worth it.
Yeah.
You know, it was almost word for word like the mock code. It started to freak me out a little bit. No, but everybody did what they were supposed to do. That was the thing. I was really happy with the team. Yeah.
When she first got here, what were her thoughts?
Nomás pensé que aquí ya estaba más sola.
She was
Estaba
alone,
preocupada,
worried.
qué es lo que va a pasar.
What's going to happen?
Pensé muchas cosas.
And she had lots of thoughts in her head.
Cuando hicieron la primera cirugía, Dios me dijo que ellos van a salir bien, porque Dios me dijo, yo voy a estar contigo, nunca te voy a dejar sola, son mis hijas. Estaba feliz.
That is a wonderful testament.
We
We might keep them a little sedated, but I'll have to discuss that with the team, what's best. Do you have any question about that?
¿Tiene preguntas sobre eso, Luisa?
No, está bien. Igual, primero Dios que van a estar mejor los cirujanos para que
Just God willing that everything goes well and that God's working through your hands.
I hope so, thank you.
You have to really spend some time looking at how these vessels come together, and I'll show you. The problem is that the anatomy is distorted relative to what we're used to. One of the things you can notice about this, if this is the middle of the head, the blood vessels are all shifted over. This is the midline, what I call the sagittal vein, which is akin to the sagittal sinus in most kids, but it's not even at the midline, it's over off to the side. I actually have to spend time manipulating the images so I understand it. I've thought about this day after day, and I woke up in the middle of the night with an understanding that I didn't have before. If these kids were apart, this structure would be this structure. Since they're together, this is the modification that had to happen. And so it starts to actually make sense. The area we'll be operating on tomorrow is right in here. This is what we're trying to preserve right there. And then meanwhile, this is crossing with veins that are coming from Augusto's brain back into this torcula here. So
I had to clamp him about 5 minutes after unclamping him because he would dump 5 within the 5 minutes. But other than that, Augusto had no acute changes overnight. He was stable.
And this is, I mean, it's pretty well healed, so I think it's just giving a scalp expansion. And so where I want to go next is I want to come here, and there's frontotemporal connections that are small, and so get those done and actually start doing some of the frontotemporal dissection and getting across. I feel very, very comfortable with who we have. From the anesthesia standpoint, Dr. Antosh is an outstanding person that really cares about everyone.
We'll take great care of them.
The anesthesia team is amazing. Sean Antosh has put together kind of the dream team, and they're just shooting nothing but 3-pointers.
As an anesthesiologist, I don't want anything bad to happen, but we always think about the worst case scenario, how we can fix the problem before it's a problem. How do we prevent that from happening? We've realized over time anything can happen at any moment. We had 2 teams, so Augusto's always blue and Pedro's always gray, and the care team taking care of them had to switch their scrub colors as well. So that way we can delineate who's in charge of which child at every moment.
So anesthesia plays a big role managing their hemodynamics, their comfort, their sedation all throughout. And then in real time, getting the different specialties to work together and being the glue that kind of keeps the whole team together.
It takes a huge team to make this work. We have surgical technicians, people that prepare the instruments, radiology technicians. We have circulating nurses.
EEG technicians monitoring the brain activity. You've got people running for supplies, pharmacy urgently delivering medications all the time.
It's not just neurosurgeons, but we have plastic surgeons.
There's Dr. Salim Mancho, and there's Dr. Scott Rapp, plastic surgeons who are calm under fire.
And we have my surgical assistant, Trish. She's like the other part of my brain. She is like the reality check. She really does everything from preparing the surgeries, taking care of the patients, and with these boys, she has just been an integral part of their care. At any one time, there may be dozens of people in the room, all part of this well-orchestrated team. It's a huge undertaking, and we can't do our job without each piece there.
So that's what you're going to be dividing right there. Can you see it?
Yep, that's the first one. We had a goal of where to disconnect at, and actually visualizing where that spot was became a technical challenge. And once we were able to see that this is the right spot, we could see that it was not feasible to disconnect there.
It wasn't going to be possible to do it with sutures or cutting or any other way. I was at one point thinking, no, we can't do it. We're going to have to close and call it and then figure out a different way. You injure these vessels at the back of the brain and you only have a few seconds to live. And it goes very, very quick. And so you can't really take unnecessary risks. It would be really heartbreaking if we had to stop. We've left them worse off than they started if we bail out now. But the plan B really didn't have any guarantees that there wasn't going to be a complication on Augusto's side from it.
I just don't want to nip the torcula. Okay, that was 2.
Yeah. For 10 seconds.
Yeah, he did 10 seconds.
3 down.
Yeah.
And then 4 is the scary one.
We're gonna fire. Get ready for pressure if needed.
You've been 10 seconds.
Okay, I fired. So have the aneurysm flip ready to.
5 releases.
It's straight back.
Okay, and I'm bleeding.
Now you're bleeding. Straight back. Stealth pump. You're good. Just stick it in there. I think you did it.
It seemed to go fine. We had a little bit of bleeding when we did the disconnection, but it was well controlled. It didn't get out of hand. We were pretty comfortable once we did it. I think just getting to that spot was tough.
So this morning we assessed them and they were ready for their breathing tubes to come out. They're breathing great right now. They're just on a little bit of oxygen just because that breathing tube was in for a couple days. But overall, they're moving everything and everything looks awesome.
I would encourage PT, OT out of bed, just get up and play. I think that'll help with the drainage.
They both have been pretty much their old crazy selves, so they're having wild dance parties and pounding on each other, which makes us feel pretty good about how they're doing, because, you know, if they're acting out and being wild and normal, you know, crazy kids, it makes you feel like everything's working.
Tuesday craniotomy for vascular disconnection.
We are kind of reaching this critical moment. Now it's absolutely essential that they tolerate their own venous return without any reliance upon each other. And to me, that's a huge moment. And so I just kind of feel like the anxiety is building up to that. It's really the moment that tells you if they're going to live or die.
Oh yeah, it does feel like it.
It's right here. So come up from, where's his orbital rim at?
They are definitely tough kids. So, amazing what they've put up with.
We're going to do some venous clamping and test occlusion and see how well it's tolerated. But honestly, there's really no other way to do it that I can see. So if they don't tolerate it, I'm really just going to be stuck, and we'll have to figure out what to do next. I think this is categorically different from the first surgery. You know, the question at that time was, can you disconnect 1/4 of the system and they'll do okay? But each time, you really are taking a larger part of what's left. Now we're taking the final piece of this. And there's no way around it. There's no backup. So that this is really about whether or not they can be apart. As soon as you tie off that vessel, now you have to ask that child to rely on the venous system that they've never fully used. Will that be enough? Since they never had time to grow those structures the way they needed to, will it be enough? And that's the question.
Let's just let out real slow.
Beautiful, boys.
No?
Did you see any bleeding?
Didn't bleed. Well, I'm going to be on the cover of Staple World magazine, you know.
Look at this neurosurgeon stapling vessels.
They told me I could have my stapler. We're going to keep them asleep for several days to rest the brain because this is a new feeling for them.
Entonces no quiero ir muy rápido porque es una sensación muy nueva para ellos.
Entonces van a estar dormidos mañana y pasado mañana.
Tomorrow and after tomorrow they're going to be sleeping?
I think so. I think so. We'll see how it goes.
At every step, every surgery, you know, there's risks of terrible complications, and every time we wake them up, it's just miraculous that they've had such a complex surgery, and it seems to not faze them. They're back to their happy, loving selves really quickly. Even recently with the tissue expanders, they've been taking that with strides.
Up until now, we've been working primarily on separating the circulation between the two brains, which we've seemingly successfully done. What's going down today is we're going to be placing tissue expanders under the skin to try to stretch out some more scalp, and we're going to try to get some extra skin that we can use to cover the skulls. We'll blow these up for several weeks, filling them up with saline solution until we get enough extra skin we think we can get the brains covered, and then comes the marathon.
What are the hopes? What hopes does she have for the boys?
Pues la verdad que es para el futuro, para mis hijos, para que algún día que ellos van a estar bien, para que tengan bien una vida mejor. Lo que yo quiero es que estudien. Eso nomás para tener una vida para ellos.
That's good.
We're down to the final days of the surgical plan. We basically try to get about halfway through the brains, and about midnight when we're exhausted, we all go to sleep. The next day we come back and we start working this way, and that's the plan. Here's the general concept. Disconnect this and the coronal vein, which is essentially the trolard coming from frontal and parietal. That leaves you. I do schematic drawings to sort of train my mind as to what to expect. If I was to remove bone at a certain location, what would I see? And I do a mental process of the steps that I would go through to open the planes and access those structures. The reason why I draw it is because that's the way I learn it. This becomes very confusing unless you have a roadmap. Sometimes just drawing the same structure over and over is kind of a meditation that I do, so that when I actually see it, it makes sense to me. That's one thing that's so striking about this whole project. I've literally studied this probably for hundreds of hours, and I look at it and I still get confused. Augusto's face down, Pedro's that way. This is kind of what we're gonna be seeing. I can't tell if we're crossing or not. The angio looks like it's like we're done with it, but the CT angio doesn't. It's agonizing. But here it is again. There's that disconnection with the tie.
Okay.
You know, and you can see what our issue is we don't know exactly where that interhemispheric vein dives.
Yeah, right.
When we were dissecting between the brains, we found something that we didn't know about. Found in the surgery that there was an artery It came up right at this spot, and it ran this way, and then it connected in to the other kid. And so it was feeding his cortex. It's not really clear what the function of that particular spot is, but when we cut that vessel, this kid gets a stroke. Not really clear. I really have thought about it a lot, and it ends up becoming kind of an anxiety dream at some point at night. The other kid. I kind of feel like we're not going to know where we're at until Wednesday.
Wednesday, yeah.
Midday or something.
Yeah, we'll be here, as a backup, we'll be here until 5 p.m.
Welcome to everyone. There are two precious children of God whom will go through a significant surgery, and we love them, and we pray for their well-being.
When someone has a stroke that affects their language, it can affect the ability to make speech even though you can understand it, or can allow you to make speech that doesn't make any sense and you can't understand what anybody else is saying. Both are very debilitating. It could be just a pure motor injury, maybe the hand or the face, or maybe the leg. It could affect sensory function. And so it's really kind of hard to say until we do it. Mom's gonna be aware of it. Everybody's gonna know that we're expecting weakness, and it could cause, speech problems as well, Augusto especially.
What will happen is we're going to be on Precedex infusions, vecuronium infusions. So when you guys aren't operating, we can turn off our gases to clear it for a little bit, and they'll be fully sedated, but we won't have any problems with vasoplasia. I just don't know what we're going to see. Ultimately, we have to be under this. Problem is I can't quite picture it.
Yeah.
That's just the way it's going to be. They're going to take a hit. They're going to potentially be set back. Other people who went into situations like this say, we know that you're going to lose function and that's an acceptable risk to us. It's horrifying to me to hurt somebody on purpose, even if it's for a good purpose.
You guys are ready. You've gone through every scenario you can think of. So just like Eisenhower said, planning is everything, plans are worthless. You will be affected by things you don't predict intraoperatively. It's okay. You've gotten prepared for any unpredictable scenarios because of all the work you've done.
I'm worried, but I do think that we've prepared more than probably anybody's prepared ever, and I don't think that anybody understands it better than us. And so we're at the point where we're ready to move forward with the final disconnection. So after 2 years of planning and 3 major disconnection surgeries over the past 6 months, time's finally come to separate these boys.
When the boys first arrived, their favorite song was I'm a Little Serpent. So we watched that video countless hours with them when we were going off to sleep and then waking them up when we were doing all the imaging studies. So we decided we would do team hats of little serpents. So through the course of it, everyone's going to be having the little snake hats that we have on to honor them, their heritage and what they loved when they came here.
What does that mean?
Bringing them down today, they're still the happy, excited 3.5-year-olds who love Coco. We don't get to see them again awake until this is all done. So that's a little scary, but it's very exciting for them.
We've done 4 craniotomies and a few other procedures in between, so I think they're up to 19 anesthetics overall.
Since we've done so much anesthesia and so many surgeries on them, everyone has gotten to know their anatomy, their physiology, and them very well. We know how they act under anesthesia and what to expect, so I think we're more than well prepared.
We've put them to sleep. We've wired their breathing tubes in. We've gotten vascular access, art lines, central lines, all the ways that you can give blood and, medicines to kids.
I feel like we're very prepared for this hopefully last step of getting them finally separated.
I don't think it's possible to have attempted to do this in a way that was safer for these kids. I think we've done everything we could possibly do. Now it just remains to be seen if it works.
All right, buddy. Sir?
This is going to be what we call a circumferential craniectomy, which means you're taking bone off all the way around. One child will be face down and will come from one side midway between the brains. And when we get to a good stopping point, then we're going to flip them and go the other way. It's going to be a long, meticulous dissection. So it's going to be kind of a long day.
Yeah, we're not all the way through this thing. You need one more staple shot.
Okay, all right, okay. I'm gonna come off and just see how it goes.
All right, do it.
Oh, dang it. Subarachnoid adhesions, are you kidding me?
You knew it was going to be too easy to...
No way! It became real clear that frontal and temporal lobes were connected and they just were not going to just fall away from each other like I had predicted.
It's just that it is adhesed completely.
I mean, it really looks on the imaging, there's subarachnoid planes everywhere.
Yeah.
You can see it, you can see the spaces.
That was the major one.
Then we just got to keep coming around, and that's going to be the goal for tonight. I think we need to see it from above, I'm afraid he's got an MCA coming from the other way doing the same thing.
Yeah.
So they're both going to have stroke.
Yeah.
All right. When you say close it?
That might be the safest thing to do.
All right, let's do it.
Just so we don't hurt them more.
Yeah. The blood vessels from one child were feeding the speech area of another, and that kid's blood vessels that should have been feeding his own speech area were feeding the other kid. And that was not clear to us from the angiography, from the MRI, from the CT angio, so we really couldn't have known it.
Good morning, Rob.
Right.
Rob, have you heard the good news?
Oh, please give good news.
Labs look great. Blood pressure's normal, like 110s to 120 systolic without inotropic support. Good news.
Just wish we could get the brains apart now.
It'll get there.
God, that was a struggle. We're gonna try a new angle, so we'll see.
The second morning, we came in from the left side, and we had the angle that we needed. We were able to get between the brains, get a good separation, and then that took us to mid-afternoon on the second day.
Straight up. Okay, now let's go ahead and rotate. 1, 2, 3. We're rotating. So it's gonna be something like that.
We pushed on through the night and started that third stage. We were getting torrential bleeding from one of the sinuses that we could not get around.
It's just every time you touch any part of his dura, even the virgin dura wants to bleed.
We were probably 9 hours at the same site. We hadn't moved a millimeter. Ultimately, the stapler was the key. We would staple, pack, wait, staple, pack, wait, and we just kept on moving forward with the stapler, and eventually we got across the site. There were adhesions of the brain to the lining. We actually had to sacrifice some of the frontal cortex to get them apart. At this point, we'd already caused more sort of intentional damage than we had set out to do, or that I was sort of emotionally prepared to do. So that was very difficult.
I knew that I had hit my limit. We rested and then we got back to it, and I think it was the right thing.
There's no choice now. You can't stop. Well, sometimes getting everything.
We were depleted. I hit a point where I thought that maybe this wasn't possible. And I thought that we might lose him. And then we hear from the anesthesiologist, well, Pedro's lungs aren't going to take much more of this.
It was much longer than any of us expected. After being in the operating room so long, body physiology starts to change a little bit. Basically, they were just showing that they needed to be separated.
By the time we were on the third day of this huge surgery, we were starting to flag a little bit.
There was nothing we could do except get them apart, because once they were circumferentially disconnected,
the bones were separated. You cannot move him. He's going to die. I was at the point where I was like, this isn't even possible. We can't do it. I thought this is going to be another 10 hours of us looking at it. At that point, I couldn't think anymore about how we're going to get through this. And at that moment, Scotty Rapp comes in. He said, Rob, all you have to do is get to my finger. You're almost there. Just get to my finger. And I just feel like Dr. Mancho and Dr. Rapp came in and just got us through the very end. They really saved the day.
I was clearly a little more fresh, because I wasn't sitting under the scope for 2 days straight. And so we just needed to keep moving forward, and that was really the main goal, was that we just had to keep moving forward, and that was it.
No, we're free. Yeah, I felt like it should be just brake tech related. Okay. We're free. Intercerebral separation. 5 or 43.
Tremendous moment when we're ready to pull the twins apart. It was an amazing, miraculous thing to see.
You guys can move back first and swing out. 1, 2, 3.
I think I'm still trying to get my mind around it. When it happened, it was surreal.
Separation is a huge change for their bodies, and it's very easy to not survive something like that. This didn't stop in the operating room. In the ICU, they were working around the clock to make sure these kids were okay. We went through weeks of critical care where we needed every specialist to help us with every system to keep them on track. Augusto was extubated and awake on Easter Sunday. It was a real gift. That reinvigorated everybody to see that he was doing well and was actually on a trajectory towards recovery. We are now 2 weeks post-separation. Brain imaging looks like there's nothing to prevent them from recovering. We see that the brain stems are fine, arterial supply is strong, and the venous drainage looks appropriate, so we're pretty happy. It's just going to take them the time to recover, and so we just have to stick with it. I think the gains that you make early on set the tone, and so we really have to get them on the right track for a neurologic recovery. Pedro's been slower to recover. He should be getting extubated today. It's going to take some time for him to catch up with Augusto. We have Augusto working with physical therapy, standing for short periods of time, sitting. He's moving all of his extremities and just very slowly getting his strength back.
We got a scan, and areas that there were, was quite a bit of hemorrhage and swelling initially looked as if they had recovered quite well. And the other crazy thing was Pedro started to grow a skull. He has grown 2.5 centimeters of skull. So it's not like he's growing back a skull that used to be there. He's actually now growing a skull that was never there.
I think the recovery that they have to go through now was difficult. For example, how hard it is just to stand up straight if you've never done that before. But I think we accomplished what we wanted, which was to give them a chance at quality of life. The first time I saw a smile or a laugh, I just felt they are going to have quality of life. This was the right thing.
You can tell that their personalities are coming back out, and seeing Augusto like that is just amazing to me.
This is truly what Dayton Children's mission and values are all about. It touches everything that we do and everything that we are.
Igual como agradezco a todos los equipos médicos y tal como enfermeras, todo lo que trabajan en el hospital, me ayudaron bastante. Sí, gracias a Dios también que están recuperando. Como ya no podemos platicar como antes, ahorita ya estamos empezando de nuevo otra vez. Augusto estaba feliz y Pedro no, porque no estaba con él. Cuando llegué a ver a Pedro y Augusto empezó a llorar. Entonces me tuve que regresar con Augusto. Pero Pedro también se quedaba llorando, por eso que no sé cómo hacerlo con ellos.
Yeah, the care did not end with the separation. About a year after the separation, we did a reconstruction of the skulls. It took a while for the wounds to heal. They continued to do their neurological recovery and therapies during that time. And then, once we were set with that, we were able to get them back home.
Adios! Adios!
And that was always the intention, is that they would go back and be in their culture and live the life that they're supposed to live their best life,
To have them at this point, it's incredible.
Here we go.
They found a great home for the kids.
This is the therapy room.
And seeing them in that environment made me feel really good. They were playing with the other kids. To see that they're going to be loved, the people are going to work to support them, and I think they are going to thrive. And I think what we were seeing in the months leading up to going back to Guatemala is that Augusto was speaking again. He was saying 4 or 5 words, and Pedro just started talking. So that is going to pick up because they're young enough where those functions can transfer to the other side of the brain.
Hi, Pedro. ¿Cómo estás?
The strength is going to be a long-term problem for them, but we are seeing that with support they can stand, they can take steps. So I think they're going to walk. Because I do believe over time there's going to be quality of life. So the prognosis is good. It's a long process. They sort of have to reprogram.
They're fantastic.
We talk about providing optimal health to all the children within our reach, and what we're doing here is we're extending our reach.
Good morning, fellas.
Eventually, Augusto's heart was going to fail, and eventually Pedro's kidneys were going to fail. We had to do it. It was the right decision ultimately. We still have work to do that we're doing remotely with them, and I still think about them every day. I was thinking about them this morning, as I'm kind of planning my day of, those kids will always be a part of me now, and they're going to be a part of my life forever, I think.